Let me now recognize Belinda Pettiford, President of the Association of Maternal and Child Health Programs. And Ms. Pettiford, you are recognized for 5 minutes for testimony.
Thank you, Chair DeLauro, Ranking Member Cole, and distinguished subcommittee members. My name is Belinda Pettiford, and I am grateful for this opportunity to appear before you today on behalf of the Association of Maternal and Child Health Programs, known as AMCHP. I proudly serve as the board chair and president of AMCHP, as well as chief of the Women, Infant, and Community Wellness section here in the Division of Public Health of the North Carolina Department of Health and Human Services. In fiscal year 2023, AMCHP requests that the subcommittee fund the Title V Maternal and Child Health Services Block Grant administered by the Health Resources and Services Administration at $1 billion, including a robust increase for the state formula fund. We are thankful to the subcommittee for the increases in funding for the block grant over the past several years and for recognizing the essential role Title V plays in improving the health and well-being of women, children, including those with special healthcare needs and their families. As you may know, the Title V block grant is driven by evidence, flexibility, and results to ensure access to quality maternal and child health services, reduce infant mortality, maternal mortality, and preventable diseases and conditions, and promote family-centered, community-based coordinated care for children with special healthcare needs. The block grant funding is distributed to every state and territory by a formula tied to the child poverty rate. Another significant portion of the block grant is awarded through special projects of regional and national significance, or SPRANs, which are discretionary grants that support a range of programs, including those to train the next generation of leaders in MCH, to support innovation to improve maternal health outcomes, and so much more. In order to illustrate the far-reaching impact of Title V, I would like to share a few examples of how the state formula funds are being used in various states. In Florida, the State Maternal Mortality Review Committee identified leading causes of maternal deaths and issued urgent maternal mortality messages to healthcare providers and hospitals around obstetric hemorrhage and hypertensive disorders to prevent future maternal deaths. In Massachusetts, the shift to provide home visiting services in a virtual manner ensured a new mother in crisis was able to get the counseling she needed. As this subcommittee members are aware, our nation is facing an unprecedented shortage of infant formula. Title V agencies around the country have been using their voices as trusted messengers to share critical information with families and healthcare providers about how to obtain formula, as well as to warn of misinformation that has been spreading through this crisis. In North Carolina, we are closely monitoring supply, working with the federal government, with manufacturers and retailers to get more formula on North Carolina shelves. We're sharing information and resources and are working specifically with our Title V MCH partners to share this information with families. During the past 2 years, Title V funded programs have been at the forefront of COVID-19 response efforts, with a particular focus on addressing the unique impacts of the pandemic on maternal and child health populations. The flexible nature of the block grant made it easily deployable source of support for states to respond to the public health emergency. However, while the block grant is the backbone of our nation's public health infrastructure for women, children, and families, that infrastructure has been severely strained as a result of this pandemic. Maternal and child health programs and the workforce need sustained increased investment to rebuild, to recover, and best serve the nation's maternal and child health populations now and in the future. Further, our nation has longstanding racial, ethnic, geographic, and social economic inequities in MCH outcomes. While incremental funding increases to the program like the Title V block grant make a difference in advancing maternal and child health, to make transformational improvements that finally address these inequities, we will require transformational investments in the block grant and complementary federal programs that support maternal and child health, including CDC's Safe Motherhood portfolio of programs, HRSA's Healthy Start program, and CDC surveillance for emerging threats to mothers and babies network. We thank you for funding the Title V Maternal and Child Health Block Grant at the $747.7 million in fiscal year 2022, and urge you to provide an increase to at least $1 billion in fiscal year 2023, including a robust increase for the state formula fund to ensure that states have the public health foundation they need to support healthy children, healthy families, and healthy communities now and into the future. And I thank you so very much.
Thank you. Thank you very, very much for your testimony. I'll just make some comments, but let me just ask the ranking member if he has comments and questions, and follow it up with Congressman Fleischman.
Don't have any questions, but I want to thank our witness for her work. It's really important. I mean, again, as our colleague, Mr. Fleischman said, one of the great things about this committee is you learn a lot because it covers so many areas. And one of the things I was sad to learn, over the course of my service on this committee is how poorly we as a country stack up with other countries in this area in terms of maternal health, and then how great the racial disparities are, something that we, as the chair mentioned earlier in another context, we all knew were there, but the COVID really brought it home. And I know she will focus on this. We will focus as a committee and do the very best we can, but I want to use this forum to also put out a challenge to some of our friends at the state legislature. I know in my state, we don't fund enough in these areas, and we have some of the worst statistics in the country, quite frankly. And I'm proud of what this committee does, and particularly under the leadership of our chair. We're putting a lot of money, and I'm always for having a rainy day fund at the state level. I live in a state that is a boom bust state because of commodity prices and energy and agriculture, and so that's a wise thing. But when times are good and when the federal government has put as much money out for a variety of healthcare purposes as it has over the last 18 months to deal, I think very appropriately with COVID, some of that money needs to be directed towards some of these programs in terms of matches for what we do and what have you. So again, this is an area that of great concern and one that I look forward to working with the chair on as we move forward. But thank you for working on the front lines in North Carolina on a problem that really ought to embarrass us all as Americans. We need to do better in maternal and infant health than we're doing. Thanks for your efforts, and thanks for your advocacy and bringing it here in front of the committee and making such an important case for all of us to hear. Yield back, Madam Chair.
Thank you, and I too want to say thank you for the testimony. I think it's we've been talking about seizing the moment. There is such a very big focus and interest on the issue of maternal and child health programs, and we need to seize this opportunity to further them. It has been really, and we have a heavy emphasis even in the 22 appropriations bill, the 2022 appropriations bill. Great advocacy by so many members of the Congress, our caucus. And so that is an issue that has been put front and center in so many ways. And that, I assure you, will continue. But the advocacy needs to be continued because, again, the disparities that have been demonstrated, and the issue with Black women, this is a pretty extraordinary. And oftentimes we lose track of the serious issues that childbirth may bring. And people just view that, well, you're going to have a baby, everything's going to be okay. It's fine. It's not the case. It is not the case. My own personal experiences with, my stepdaughter some 17 years ago, we thought everything was fine. And at one point we almost lost both my granddaughter, who is now 17 years old though, and her mom. And it was harrowing, and we had no idea, that this was something that could come from a regular pregnancy. So, but I just tell you, keep at it at this moment, because the window is open. The window in Washington shuts very quickly. So just continue the advocacy so that we can really join the ranks of other countries, and they're paying attention to health and welfare of of women and children, women's and children's health in this country. So thank you very much for the testimony.